Welcome to Speak Life with Dr. Amy Chai. Information for your best life. Now, here's Amy Chai.
Hi again, everyone, and welcome to Speak Life New Haven. Today, I want to talk about something that's very near and dear to my heart, and that is the treatment of opiate addiction. And I know you've all heard of the opioid epidemic, and it's very true. Here in Connecticut, we have so many people dying and so many people's lives who have been really damaged and disrupted by opiates. And by opiates, what I mean is usually synthetic opioid medicines like heroin and fentanyl. And there's been a lot of overdose deaths, especially because there's so much fentanyl that comes across our borders now. And so it's really in almost all the drugs. So the first thing I kind of want to talk about is, it's really important, and it's what is actually, you know, what is opioid addiction? Now, there's something called pseudo addiction. And pseudo addiction is really nothing more than a dependence on an opiate drug. And a dependence you might actually get from a pain pill that you have to take for, say, for lower back pain or something. And if you stop taking it, you can actually develop withdrawal symptoms. Um, and a withdrawal symptom would be something like sweating, dilated pupils, feeling nauseated, vomiting, feeling like you have the flu, except much worse. Now, you can get this from suddenly stopping any opiate if you've been on it for a while. But just because you withdraw when you don't take your medication doesn't mean that you're addicted. It just means your body has become dependent on it. So there are people who do need their medication, and if they don't take it, they're going to have problems. Now, that does not mean that they are addicted. So, what what is addiction? And I'm going to take you back to a slide that we used before, and that was the addiction spectrum slide. Um, this was casual use would just be normal using it for your health. Um, Pre-addiction would be where you start to possibly take a little more than you should. Perhaps you start thinking a lot about taking the pills. And then before you know it, you're into full blown addiction where the pill starts to kind of take over your life. And I've had patients who were taking oxycodones, and they basically sold everything they had just to get more oxy. And eventually they couldn't afford to get the real pills anymore. So they started buying street drugs. And almost all the street drugs out there now are contaminated with fentanyl. So if you get a street drug, even if it's supposed to be a Percocet or it's supposed to be an oxy, chances are very, very, very high that it's actually a fake pill and then it's actually made out of fentanyl. And swallowing it could actually kill you. And they're also making fake Xanaxes now. And also, it's gotten into the cocaine supply. So, pretty much anything you get on the street could potentially have fentanyl in it. And that background of having so much fentanyl, which is, by the way, it's 100 times stronger than heroin. And people are dying left and right just from a single dose. Um, the fact that so much fentanyl is in the street has really changed our treatment approach to opioid use disorder, or OUD. So let me go back to this slide and let me explain a little bit about what OUD is. I told you what it isn't. It isn't just being dependent on a drug for your pain. And it isn't just the fact that you might withdraw if you stop taking the drug for your pain. That is not addiction, that is pseudo addiction. It starts to become an opioid use disorder or a legitimate addiction when it starts to interfere with your life, when you start thinking about it constantly, when you start perhaps misusing it. Perhaps you go out and buy street drugs. Perhaps you get arrested. Perhaps you have a DUI. Perhaps you lose a job. Perhaps your family members are getting concerned. Those are all symptoms of a real addiction, not just a pseudo addiction. So we have a lot of people in Connecticut who do have legitimate opioid use disorder or addiction to opiate substances. And this is something that's very serious and it's very deadly and it's very hard to treat. So, what are the treatment options that we have? If you look at this slide here, the first slide that I've put up, and the thing that people most talk about is something called detox. And someone who's new to opioid use disorder, someone who's just started to realize that maybe they need that pill a little too much, maybe they're crushing up the pill and snorting it, maybe they're going and buying extra pills from some shady guy in the street corner, or maybe they've gone to bags of heroin. They know they're in trouble. They know this is a terrible thing. And they're starting to get really afraid. But they know that if they don't take an opiate, they're going to feel terrible. They're going to feel achy and anxious and restless and sweaty and nauseated and diarrhea, like the worst flu you've ever had, except worse. And they're afraid of that. People are terrified of going through withdrawal because it can be so very uncomfortable. And so, a lot of people, their first thought is that they should go to detox. And a lot of times, what happens in detox is that people get perhaps a little bit of Suboxone or a little bit of methadone, or sometimes they even get um, anesthesia to get them through the horrible discomfort of going through the actual withdrawal. Now, the withdrawals are much worse now with fentanyl than they were with, and I can't believe I'm saying this, but than they were when it was just only heroin, right? I mean, heroin's bad enough, but fentanyl is so much worse. And it turns out that the withdrawals are also worse. So you get people looking for detox where they can be taken care of in a medical setting when they undergo the removal of this opiate substance from their system. And now, if you're new to opioid addiction or you know someone who is, I am going to recommend actually against your traditional detox, and I'll tell you why. Um, the detox, a lot of the detoxes you have out there, private detoxes, what they'll do is they'll have you in the facility for a while. They'll get you through the withdrawal, and after that, you think, oh, well, all I have to do is get through the withdrawal, and then I'll be totally fine. But the truth is that you're not fine after you leave detox. And what I've found is that people are often using again before they even get home from the detox. They've already stopped by their dealer and they've already started using again. So, really, the detoxes I have found to be pretty useless for my patients because the relapse is almost immediate, is what I've found. And in fact, one study showed that like over 90% of people will relapse pretty quickly after a plain detox. So the relapse rate is very high. And then if you manage to hold off a few days or the opiates all out of your system, you can very quickly lose your body's tolerance to the opiate. And so then the problem becomes that if you do relapse quickly after detox, you're actually more likely to die because you've lost some of your body's resistance to the drug. So I really don't recommend detox unless it is followed immediately by methadone maintenance and or Suboxone treatment. Um, Now, methadone maintenance, as you probably know, is where you go and it's exclusively for opiate use disorder, and you get counseling and you get methadone. Um, and Suboxone can often be prescribed through your family physician. So it may be a little bit more discreet in some ways, but a little bit less discreet in others. Um, and I'll tell you why that is. Now, the methadone clinic is actually has a lot of federal laws in place, and it's very, very private. We as physicians at methadone clinics are not allowed to discuss your care with anyone without your explicit consent and your specific consent for whatever you need to have discussed. And the fact that you're using methadone will not be on any record at all whatsoever. It won't be on record at your pharmacy. It won't be on state records. It won't be on any records except for our records at the methadone clinic, which are secure by federal mandate. So unless someone watches you walk into a methadone clinic, they have no way of knowing that you're on methadone. Even your physician doesn't need to know, although we certainly recommend that you share this information with your physician. Now, what about Suboxone? Suboxone is given through your pharmacist. So if you're afraid of walking into the actual methadone clinic, which there's nothing wrong with the methadone clinic, the people are usually pretty nice there. Um, I am nice anyway. And I think most everyone else is too. Um, but Suboxone treatment you can get oftentimes at your own physician's office. But the drawback is that the state pharmacy record will have record that you're on Suboxone. Your insurance company will know, and um your doctor will know, and it's a lot easier to find out that you're on Suboxone than that you're on methadone. So there is a little bit of a privacy trade-off for the um, for the convenience of having Suboxone. Suboxone is easier to take, and you don't have to go frequently to the clinic as much. So it's a trade-off. They're two different types of substances. The Suboxone also means that you have to be off of all opiates for at least 3 days, which means that you'll have to endure some degree of withdrawal before you're safe to go on to the Suboxone. And the other treatment that I haven't mentioned here is actually Vivitrol injections, which is sort of like Narcan, except it's given in a shot underneath your skin, and it helps you to avoid using. So those are the three medications that we use to treat opioid use disorder. And I'm going to say that because of the danger of the opiates today, I would not recommend just going to detox without getting medication along with it, because I just think that that's not safe. So everybody's got that friend, right? Um, and that friend might be, it might be your brother, it might be your cousin, it might be your uncle, but that person just looks at you, gives you a funny look. You're going to a methadone clinic, and they say, "Isn't methadone just substituting one addiction for another?" And these people don't understand what addiction is, and they stigmatize the treatment of a medical illness. Now, these people wouldn't ask you if you were addicted to insulin or if you were addicted to your blood pressure medicine. They wouldn't shame you for taking normal medications that we use for our health. But for some reason, people want to shame people for taking methadone. What these people are actually doing without even realizing it is they're advocating for you to stop a medication that could very well save your life. And if you need methadone and you're not taking it, your risk of death goes up quite substantially. So if someone in your life is telling you, isn't methadone just substituting one addiction for another? You say, no, my doctor said I need methadone and I'm taking it because I want to live. And I hope that you want me to live as well. And hopefully that will shut them up. Sometimes it doesn't. But it's hard for people to understand sometimes medical things. So, how do you find a methadone clinic? Well, you just look them up online. You find the one that's closest to your house, and you give them a call and find out when to come in for your admission. And usually methadone clinics open up around 5:30 in the morning because people like to come get their methadone before work. You're going to need to know that you're going to have to show up every single day to get a single dose in a single bottle of methadone. It's a liquid, it looks like Kool-Aid, and you drink it. And if you have clean urines, eventually you'll be able to get take-home bottles, which you have to keep locked up in a box to prevent anyone else from getting access to them or possibly accidentally killing a child that wouldn't be able to tolerate the dose. And because it does look like Kool-Aid, of course, it would be very unsafe to leave it unlocked. And the Suboxone strips, they sort of look like chewing gum. So those also have to be locked up. So locking up your treatment medications is critically, critically important, especially if you have children or if you have pets, because terrible accidents can and have occurred. So what we do typically is if you can walk into a methadone clinic and having recently used, you don't have to be clean of substances. You just walk in, just come as you are, and just be honest with people at the methadone clinic. They'll start you off on a low dose of methadone, 30 milligrams usually, and gradually the dose will be increased as you gradually are able to decrease whatever medication or whatever opiate drug you're using, be it heroin or fentanyl, until you get to a dose where you aren't having withdrawals when you're not using any street drugs at all. Preferably, you're going to feel normal with no withdrawals when you get to the right dose of methadone, and that will enable you to stop using drugs. And that's where you can start all the counseling, you can start all the help, you can start all the recovery. And that's what you can expect at a methadone clinic. You can expect counselors, you can expect fellow travelers, you can expect doctors, nurses, people who will maintain your privacy to the utmost. And you'll feel welcomed and you'll feel comfortable. So the next thing I wanted to talk about is tapering off. Now, there's a lot of people who come to me and they ask, well, when can I get off of my methadone? And some people need to be on methadone for life because the brain changes after you become addicted. And the brain changes mean that you're less able to control your impulses. You're going to have triggering of your cravings, and it's going to be very hard to maintain sobriety on your own without medical help. Sometimes people who can't get off of methadone are people who have a lot of mental health problems, and they get triggered frequently when their mental health problems get worse and then they relapse. So sometimes we feel it's safe to leave them on for a little bit longer. But I never recommend tapering off treatment until it's been at least a year or two. So you've had a chance to really, really work your recovery and really, really feel well about it. Now, if you see there's a graph on this chart here, and the graph shows it shows with and without treatment with buprenorphine. And as you can see, the line on top is people who were given buprenorphine, and the line that plummets to the bottom is people who were just let go from rehab without taking any medication like buprenorphine. So as you can see, 100% of patients left treatment who weren't given buprenorphine, but only 25% of people left treatment who were given buprenorphine. So, giving medication really helps people stay in treatment, getting counseling, being healthy, feeling well. And what happens when people relapse? Well, in the age of fentanyl, relapse can often mean death. So, the first thing you have to ask yourself is, why do I want to taper off? Hopefully, it isn't because someone's telling you that you shouldn't take methadone. That's not a good reason to taper off. It should be something that you decide very carefully with your counselor and your doctor, and it should be appropriate for you and for your other medical conditions. Because staying in treatment does a lot of things. Not only does it reduce overdose deaths, but it reduces deaths from all causes. And as you know, there's a lot of other causes of death that sometimes occur for people with drug use. Some of those would be accidents, some of those would be violence, some of those would be cancers from smoking or liver damage from drinking. But people who remain in treatment are less likely to die from all causes, not just opioid use causes. So there's a very good reason to stay in treatment. And frankly, it's because it reduces your risk of death. And it reduces your risk of death even if you continue to use while you're using like methadone. And a lot of people do continue to use, they just use less. Um, and what we try to do is get them to use less and less and less until they're finally clean. And that takes a long time for some people. And some people never get there. But we work hard to get people to really be clean and to really, regain their health. So I recommend that you don't taper off of medication like methadone or Suboxone until you're very, very stable. And what do I mean by very, very stable? Well, there's a lot of things that contribute to how stable you can be in recovery. If you're just getting out of a halfway house, or you've just been released from prison, or you've just moved, or there's something new in your life, that's not a good time to taper off of methadone, because those are high risk periods of your life where you're likely to get triggered and you're likely to relapse. And one of the things we hear all the time is, he was doing so well and now he's dead. And the reason is that that person really was doing well, and they were doing so well that they thought they could leave treatment. And then what happens is that they relapse, but they've lost all of that tolerance that they had to the drug. And that's a very, very high risk time. And people do die. They die because they taper off too early, or at a time that's inappropriate for them to taper off. So, this is a very serious decision, and it's a decision that should be made in conference with your doctor, with your therapist, and with your psychiatrist. It's a very important and serious decision. It's not going to hurt you to stay in treatment. It's not going to hurt you to stay on methadone. And eventually, when you're doing well, you get bottles to take home. So it becomes much and much less inconvenient you may only end up having to come once a month to get bottles, and that's much more convenient for people. So keep working with it, don't give up, keep trying, and let yourself have time where you're in recovery, time where you're supported, you're doing well, and then slowly taper off when the time is right. And when is the time right? The right time is usually when you have a stable family that supports you, when you have a stable job and you're going to work and feeling good every day, when you don't have a serious, untreated mental illness, and when you're not going through major life changes. Those are the best time to slowly taper off. And that's going to be something that'll be supported by the staff at the clinic as you develop your plan for tapering and your plan for discharge. So, what happens after discharge? I mean, recovery, as we know, it's a lifelong process. It's not a one and done thing. Because, like I said, there are brain changes that are long lasting, and you're going to have to learn to live every day, one day at a time. And I know that sounds like a cliche, but it's actually true. One day at a time, you're going to have to face life, knowing that you could be triggered with your addiction. And so you need a ton of support, a ton of support. And I'm going to show you how to get that support. One of the biggest risks is people kind of getting cocky. They think, oh, I'm doing so well. I've done so great. I just don't need any kind of treatment anymore. I'm tired of meetings. I'm tired of talking to people. I just want to do things by my own, on my own, by myself, because, I'm pretty together now. I can handle it. But that is overconfidence. Please do not be overconfident. Your family, your friends, people, places, and things that can trigger you has to be continually monitored. Just like if you lose weight, you have to continually step on the scale. And it's the same way with recovery. You have to continue in recovery. It's a process. So I'm going to give you some information of where you can look and you can find some help here in Connecticut. The first is the Department of Mental Health and Addiction Services. It's also called DMHAS or DMHAS. And you can find all the DMHAS information on portal.ct.gov/DMHAS or DMHAS, Department of Mental Health and Addiction Services. And one of their very good programs for women is called Women's Reach, and they'll help pregnant women get the care that they need. It's very, very important to be in treatment when you're expecting, because withdrawals can cause miscarriage. And it's very important to be in treatment, and it's okay. When social services knows that you're in treatment and you're doing well, they're going to do everything they can to support your baby and to support your family. And they also have a family care plan that helps you through pregnancy, nursing, and any kind of needs that you may have. And that's through the portal.ct.gov/DMHAS. Another one is the CCAR.us. And this is the Connecticut Community of Addiction and Recovery.us. And this is a place where they're organizing trained recovery coaches. And they already have a program at emergency rooms. If you come in asking for help, they will have a recovery coach available for you that'll get you hooked up with the services that you need. Or you can simply go to ccar.us and contact them through their website. Another option for you is newlife2.org. New Life 2, and that's the number 2, not the word 2. So .org. And this program is a Black-owned program, and it is also a faith-based program. And so if that appeals to you, you may want to check out newlife2.org and check them out and see what they have to offer. And of course, I would be remiss if I didn't talk about Narcotics Anonymous, or NA. And their meetings can be found at na.org, na.org. And Narcotics Anonymous is a lot like Alcohol Anonymous. It's also a 12-step program where they have the same sort of thing with sponsors, and it's a very good way to get support from people who care. And if you have mental health problems, don't forget the National Alliance of Mental Illness, or NAMI Connecticut. That's NAMICT, NAMI Connecticut.org, NAMICT.org. And that is for mental illness. There's family support, there's patient support, there's resources and information, and there are local chapters in an area near you. So if you or a loved one suffers from opioid addiction, there is hope, there is help, and I really hope that this information has been very helpful to you. If you have questions, don't forget to pop them right in underneath the video. And I will hopefully be able to see them and hopefully answer them on another show in the future. So thank you so much for watching. And don't forget to speak life into someone's world today. See you next time.
Tune in next time for Speak Life with Dr. Amy Chai at ctpolitics.tv.